Hello everyone, I'm Dr. Bharat Bhosle. I'm a lead precision and medical oncologist at Raheja Fortis Hospital. So today we are going to discuss about precision oncology. So what is precision oncology? It's a personalized cancer care. Every cancer patient who is coming to us does not require chemotherapy or the same chemotherapy, be it breast cancer or any other cancer. Why we use precision oncology? With the help of newer diagnostics and molecular diagnostic modalities such as genomic sequencing, especially after year 2000 when the whole genome was mapped, then we were able to map the tumor genome as well. And before that, majority of the cancers were being treated with surgery, chemotherapy and radiation therapy. Yes, there used to be a lot of side effects out of all these therapies. But what has happened, every tumor can be mapped and it can be determined whether there is a specific mutation in the tumor which is driving the growth of the tumor, driving the spread of the tumor. And if we target that particular mutation, it increases the effectiveness of the particular therapy and reduces the side effect. So these therapies are called as targeted therapies, and most of these targeted therapies are available in oral tablet form. Means after year 2000, many cancers like chronic myeloid leukemia is a blood cancer for which the treatment standard was bone marrow transplant, which used to be very costly. Majority of the patient did not get matched donor, and the side effects as well as the risk of death used to be there with bone marrow transplant. But now that same disease is being treated with one tablet which is used, we use it once in a day or twice in a day, and 70 to 80% of these patients are labeled as cure. This is the way treatment has transformed with the help of precision oncology, which is called as again personalized care. Again in breast cancer, discovery of HER2 target with HER2 targeted therapies, and this deadly disease HER2 positive breast cancer is being treated, and majority of these patients are completely getting cure. Coming next to lung cancer, once upon a time chemotherapy was the only treatment available for this deadly cancer. Now there are various targets in lung cancer like EGFR, ALK, ROS, and to talk about targeted therapies, there are oral tablets available for this disease. If particular mutation is present, they are being used alone or combination with chemotherapy, and the transformation is such that now almost more than 50% of the patients are living beyond 5 years. Even with brain metastasis, these patients are living 5 years and 10 years. And before this invention, with chemotherapy, the average survival used to be 6 to 8 months, and hardly 4 to 5% of the patient used to see the milestone of 4 years or 5 years. So yes, effectiveness of the treatment has increased tremendously, and the side effect has gone significantly. Coming to the next therapy, which is immunotherapy, there are good markers, biomarkers, which can predict whether the immunotherapy works in a particular set of patients. There is something called as MSI, PD-L1. If MSI is present, the probability of immunotherapy working in diseases like rectal cancer, lung cancer, colon cancer, kidney cancer is very high, especially skin cancers like melanoma, where the immunotherapy usage started first. Majority of these patients, even in stage 4, are being labeled as cure. So this is the transformation in cancer care with the help of precision, and which is possible because of the innovations like molecular oncology, where we do able to sequence the genome of the patients with our pathologist friends. And with the help of all these kind of newer treatments, I see cancer can be cured, and we can definitely win this battle against cancer, but it needs to be fought together. Thank you.